Hi, everybody. This is Dr. Roya here. And today our program is about ADHD. ADHD is Attention Deficit Hyperactivity uh, disease. In some ways, it is ADD, which is Attention Deficit Only. So it's about a disease, a neurodevelopmental disease, starting in childhood and getting to adulthood. If it's not taken care of early on, it can cause quite a bit of problem later on in life. People can have different kind of different types of the disease. There is one of them where it is inattention is the main type, and the other one is hyperactivity, which is the main type. And then there is a third type, which is a combined hyperactivity as well as inattentiveness. Now, these people are quite focus is like one of the most important issue in attention. It could be causing a lot of forgetfulness as a result of that. And these are the people who get easily distracted. They lose things quite often. And sometimes they call them daydreamers because they are in their head most of the time thinking about things. Then there are people who are, sorry, my phone was on still. The hyperactive, impulsive people are the people who are quite impulsive. They do things, with emotions, high and low sometimes. They're generally fidgety. They can be talking a lot or be restless. And quite often they have a struggle in waiting their turn to do things. And a combination of these two could be any of these symptoms, all of them together, or all of them. A lot of people who are also hyperactive and impulsive, they have problem with the speed as well. So when later on in their life they're driving, they have quite a number of tickets because of the speeding and all. So that's another issue that they have. Most of the time when I see these people in childhood, it's because the teachers have asked us to see a child. Generally, the parents ignore even the hyperactivity as a problem because it's a child. But the teachers, they usually pay attention, and because they are trained, they can pick out the kids who are hyperactive or unable to focus on things. So they usually tell parents to bring them to the physician. These kind of kids can't sit in a circle. It starts in kindergarten, basically, where they can't sit in a circle, or all the time they're moving around, not paying attention, disturbing other kids, and getting into trouble with other kids, forgetting things all the time. Parents have got to buy quite a number of things for them, like pencils, sharpeners, erasers, because they keep forgetting them and they lose them. And they can never finish their homework, generally. Again, it all depends on the severity of it, whether it's mild, moderate, or severe. That's one of the things. And if they are severe, usually parents, even they notice that, and then they can fail in their exams, not finish them, not do the projects, continuously having low marks because of those things. At home also, they can be quite messy, not finishing their jobs or their things, their chores or anything like that. In adulthood, it's more of other things. They can start projects but never finishing them. or they leave it to the last moment. They become procrastinators. They have anxiety as a result of this because they can never finish, and then they're worried about the end result, all of those things. Sometimes their co-workers will be upset, or their bosses would ask them to go and see the doctor or they have given them ultimatum to lose their job or something, and that's when they come to me. Generally what happens is that these people, they have about, like a normal person has about 70 thoughts per minute. These people could have anything about like 100 thoughts per minute or even 140 thoughts per minute, twice of any normal person. There is some emotional dysregulation usually. So they get quite upset quite quickly, and then they can become okay after a while. They can forget things as a result of this. They also forgive easily, many of them. But some of the things that happens is that they tend not to finish their jobs, not doing their taxes, not paying their bills on time, and forgetting where they kept their keys or phones or things like that, forgetting appointments or being late for the appointments. That's a very common thing. That's very typical of ADHD as well as depression, doing all of those things. And again, these diseases can be both together as well. One can lead to the other, and the other can lead to this. Generally, what is important to know is that this is a brain wiring issue. So it is not a character fault. Rather, it's a brain wiring issue. These people are not lazy. That's not the reason they are delaying things. It's rather the wiring is such that they sometimes cannot focus, and they cannot see themselves finish the thing. And if this is gone for too long, then they kind of feel guilty half the time, and they don't see themselves capable of finishing things because it's gone too long and they have had too many struggles in the past. So it's really important that we understand that it's not a character flaw. And if there is anybody like that, then it would be a good idea to get them to see their doctor and deal with this issue. The dopamine regulation, usually the biochemistry of it is usually to do with the dopamine regulation, and that is where the issue occurs. But in terms of a structure, it is really like a brain wiring. At the same time, it is dependent on how long and how severe it has been, because then it would cause other issues for a person, and they start feeling that their self-worth like comes under question for themselves. Now, this is a very treatable disease. This is a disease that you can easily treat. In fact, it is of all the diseases that I deal with, like from depression, the common ones I'm talking, depression, anxiety, ADHD and PTSD, these are the more common ones, and of course some bipolar and all. This is one of the easiest, at least in my hands, to treat, especially if a person is willing to take the trouble of actually seeking help and wanting to get better. Because sometimes their motivation comes under question, these kind of people. However, it's not really their motivation. It is just the disbelief in themselves as a result of many years of, not being able to finish things properly or getting to the place they want to reach. These are the kind of people that you see, they'll do multiple degrees, or they do different kind of jobs. They'll go from one branch to another because everything after a while becomes boring. And so they can't deal with boring so well. These people have got very interesting strengths as well. So if they really love something, they can be hyper-focused and they can spend even hours and hours on that issue. But if they get bored with that, then they cannot deal with it even for a minute or two. So that's the kind of thing that happens with these people. It's very important that we think of the treatment for these people as two ways. One is the medical treatment. It especially helps in the people who are severely disabled as a result of this and they're dysfunctional. Um, Usually, people who are pushed by either teachers or by the bosses, they definitely want to finish and do their treatment and get better. They're motivated enough because there's a fear behind them, of losing their jobs or not being able to go to school and not being able to be successful. But there are others who are only seeking like medication, like a quick fix, literally. This disease, however, is not one of those quick fixes. It's something that needs the behavioral treatment. The behavioral treatment are few folds. The most common ones that I do use, there are so many other ones which are specific to ADHD, which I'm not going into, but there are some of them which are general and it applies to everybody in ADHD, and those ones I am going to talk about. One of them is meditation. Meditation helps by calming the mind. One of the most important issues that these people have is that they think too much. When you think too much, you do too little. Generally, people who do think too much, they do little. And those who do a lot think less. And in ADHD, one of the things that we try to do is to think less and do more. Activity is a very important thing. And for that, walking becomes a very important thing. It's the same issue of river and pond. If you're moving, you're always clear, as is your brain and your thought process. Everything else is clear. And so you can actually finish the things that you want to go, and you're clear in all aspects of your life. You have priorities, everything is clear, and you know which direction you're going. So that's a river, that's movement. So walking does cause that. But if you stay inactive, you'd be more like a pond, sitting there, collecting all the garbage in there, all the thoughts, all the negative thoughts, in fact, increases, and your self-value, doubting your self-value and everything like that becomes an issue. And so you become a useless place where your thoughts are so mixed up that you can't see anything. You can't see a way ahead. And you become even more negative in regards to how you're going to get out of that rut. You become unsuccessful as a result of that, like you can't do anything right. And because of emotional dysregulation, their relationships can be in problem. And that's another thing that can happen. So the two major part of that, which was meditation and movement, is the most important thing. So one is to keep your body moving so that your thoughts are less moving. The meditation does the same thing because it calms the mind, it reduces the thoughts. The more you do of that, the more easy it is to see clarity and to be able to focus and stay focused. People who do that for 6 weeks, they actually do quite well on a regular basis. If you do that, you do quite well. There are other things to balance the rest of the brain, which is dancing, especially hip movements. That's really important for balancing of the mind and balancing of the two halves of the brain. Laughter is a very good quality in terms of happiness. A person who is happy can see things more clearly. When you are sad and down and depressed or anxious, then you see things more haphazard and mixed up, and it's hard for you to find the clarity that you need to move forward. Therefore, happiness is an important thing for any diseases of the brain and thoughts. It's good for everything else as well, actually. It also helps with the different neurohormones, which is secreted, and that helps as well with the clarity of the mind. So biochemistry is also important in all of these things. So it's not just the energy level of it. And the last thing is the gratitude. Gratitude is a significant part of this. It is a part where you have, every human being has a way of looking at things and projecting things in such a way and that they see it according to where they have, thrown the light as. If you uh, put all of your attention on something negative, then you will actually see negative, and in that there is never going to be anything positive coming out of that. However, if you focus and throw your light at something positive that you have and others have, then you find a way out. So it's about changing the way you view the world, the way you view yourself, and valuing yourself, accepting yourself just the way you are. So yes, I am different, but that's okay. Like, I have ADHD, but I've never had issue with my self-worth. I always, as a kid, I used to kiss myself and think that I'm so beautiful. I can do anything I want to put my mind on. That ability has helped me to overcompensate, or at least compensate for the ADHD that, I had the combined both hyperactivity, impulsivity, as well as the inattention. However, I was able to overcome those things as a result of believing in myself. And that belief is an important thing. And that's why gratitude becomes important in that uh, regard. To be grateful to yourself for whoever you are and however you are, and also to others for accepting them as they are and them accepting you as you are. However, there are things that makes life easier, like medication. And if there is any medication that make life easier, it doesn't really matter. It's good that you have them in your life. And just like if you have a pneumonia, you would take an antibiotic to get better. I would say this is also an area where people can be a bit more kind to themselves or to their children, because I do see a lot of parents who are apprehensive about having their children on medication, where it is really not necessary, because if it can make a person feel better about themselves, be able to finish their job just like others finish their job, then it gives them a lot more of self-worth and ability and the power to understand that they can be finishing whatever they start. And that would help them to understand their own self-worth. So medication are really an important part of this. And there are stimulants that we do use. There are other medication depending on what other diseases they have with it. So it can be with autism, depression, anxiety, other diseases. So we could treat some of those things as well. And all of that would help you to become a better person and be able to be more effective member of society at the end of the day. And that's what we hope to achieve at the end of our lives. Each and every one of us want to have achieved something and lived in such a way that we have been happy, accepting ourselves and others, and be able to um, provide something for the society and be effective member of society. I know we have got two people here. If there is any questions, I'm willing to answer.
Thank you. I have one question about the treatment of ADHD. So my question is, are there any steps to treatment, like somebody just came to you, actually somebody come to you about the treatment? First, you start from behavior therapy, and then if it doesn't work, you start with the medical diagnosis, or no, it's based on the severity of the ADHD. Maybe sometimes you start directly with the medicine.
Very good question, actually, because it really depends on the patient. and the severity of the disease. You see, sometimes the disease are not severe, so it doesn't even need a medication or behavioral therapy for that matter, if they don't want it. Because if they are in all diseases in life, we treat them so that you are functional. So a person becomes functional. So there has to be something that's bothering others, or the patient itself, to have brought them to my office or any doctor's office. And if that is causing that much trouble, that is bothering them, and it doesn't matter whether it's the ADHD itself or whether the consequences of having ADHD, means feeling low self-esteem, or feeling, being less than others, or not being able to be enough successful, or not being able to finish your things. So even if that is the case, then we will start with the treatment. Now, the treatment itself, to me, it does matter how severe is the disease and how dysfunctional is the person. So if they're able to do their jobs and it's just the issue of self-esteem and all, then I can work on the behavioral therapy. Because self-esteem is not a thing that goes away with medication. However, if they are unable to finish their job or homework, or they're losing their license because they're speeding all the time, then of course they need some kind of medication because it's gone out of hand now. So medication usually helps me to bring them, and the level usually identifies that, because we have got forms. Like for children, we have something called SNAP. And for adults, we have something, adult ADHD forms. So we do those kind of diagnoses. And based on that and the symptoms of the patient and the needs of the patient, then we make a decision whether the medication comes first or the behavioral therapy comes first, or a combination of both. In some patients, I do both, actually, because I think they do need medication, but they can also start trying. Sometimes they're so severe that they cannot even do the behavioral therapy, because meditation needs focus for 5 minutes. And if you can't focus for 1 minute, how can you focus for 5 minutes? So that's when I know that you would need to have some medication to be able to even sit down for 2 minutes. And that's how we make a decision. A very good question.
Thank you.
You're welcome. If there is no other question, then we could say thank you for paying attention, and hopefully we'll come with another program next week. If you have any questions about this, we'd be happy to respond to that. Till next time, have a wonderful day ahead.